that low back pain is really, really common. A big thing that I want to try to get across is that very, very seldomly, so very, very infrequently, is back pain extremely serious, emergent, life-threatening, or a cause of significant tissue damage. But very, very often is it exceptionally painful and very limited. Okay, so it can play a really big role in decreasing our lifestyle and our happiness. But again, there's very, very, very few cases where that injury, even if it feels like a 10 out of 10 pain, is actually something that's a serious medical emergency or a massive amount of destroyed or broken tissue. We'll go through a little bit of the specifics there, but the reason for this is your spine, the muscles of your spine, the joints, the ligaments, all the tissues around there are exceptionally sensitive. Okay, so they have a lot of nerve endings, they have a lot of communication with your brain, and they have the ability to create a lot of spasm and a lot of pain. So even the smallest of actual amount of tissue injury, tear, sprain, strain, whatever you want to call it, can create a maximal amount of pain and limitation. So that's an important thing to keep in mind, and we're going to go through a little bit of that later on when we go through some kind of self-assessment. So we're going to cover a little bit of the relevant anatomy. We'll try to keep it as little sciencey as possible. If I get too much, send me a message and we'll kind of ease it off. If you like that stuff and you want a better explanation, please send us an email. I'd love to communicate over it. Sometimes I find it hard to stop talking about it. So when we're talking about our low back, we're talking about the lumbar spine, the pelvis, the hips, and the muscles and joints associated with that. So in this area, we're going to have a number of tissues. We'll start with the bones. We've got our pelvic joints or bones. Okay, so these big guys here, they're big and flat, nice and round. They're kind of what you might call your hip bones. You can sort of feel around here. We have our vertebral bones, all the little vertebrae through there. In your low back, there's going to be 5, plus or minus some sort of changes. Some of us will have a 6, some of us will have a fusion, not a huge issue. We're also going to have our femurs or our actual hip bones, the hip joint being in this region there. As far as our joint tissues go, we're going to have our great big guys down here you may have heard a little bit about if you have back pain, our sacroiliac joints or our SI joints. These are going to be the dimples at your lower back. Okay, those two kind of dimple spots, and what those are is where one big pelvic bone joins to the spine. Okay? Other joints, as I mentioned, the hip joint, which again is going to be right in around the groin area. We also have, and these are going to be really important when we talk about some of the structures related to our average aches and pains and even our acute low back injuries or our real sharp new back injuries, our facet joints. Again, these are kind of tough to see from here, but they're teeny little joints in between each vertebrae. And they're going to be about the size of the end of your thumb, so quite small. And they kind of cross over each other like shingles. So they have a little bit of movement like that between both bones, okay? And lastly, we're going to look at our disc joints. In between each vertebrae, there's going to be a big, thick piece of tissue called the intervertebral disc adjoining those two vertebrae. So other anatomy pieces we have, again, muscles and tendons. Okay, so our muscles and tendons are going to be stretchy. They're capable of contracting and shortening to control, move, and stabilize your region, your joints, your back. Really, really important here because in the low back, generally stability and control is going to be a big part of this, but the muscles and tendons are really sensitive. So minimal amounts of damage or trauma can still cause massive amounts of pain or even your average everyday aches and pains. And again, we will get into, before we get into exercise to help that, we'll get into the why this happens. Lastly, our ligaments and joint capsules. So super important, the ligaments and joint capsules are going to be what hold the two pieces of bone together. So they form a joint, and they are going to be non-stretchy tissues. Okay, they don't have as much give. They cannot contract and relax. They do have a little teeny bit of give if you make them, and they're not super happy to do so, but they are exceptionally sensitive. So really, 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 really highly innervated, okay? And that plays a really big role when it comes, again, to our average aches and pains, but even our really sharp, debilitating pain. okay? So, biggest thing I want you to take from the anatomy in the area, some of the stretchies, or some of the tissues, sorry, are stretchy, and some of them are not stretchy. Okay, but they're both very sensitive and capable of causing a lot of pain with minimal injury. So, a couple of principles before we move forward, and this is going to kind of drive us in. I sort of poked at it already. Your lumbar spine loves and craves stability. Okay, and the reason for this, different than your upper back or your thoracic spine, your lumbar spine doesn't have a rib cage. Okay, so your upper back has a rib cage, just this big cage of bones around it that keep it nice and stable and allow it to stay in place. Your lumbar spine just has muscles. Okay, we all talk about, oh, I have low back pain, I need to strengthen my core. And that's a possibility, and the reason for that is the only support of those vertebrae are the muscles that attach from the rib cage to the pelvis all the way around pelvis to spine. Okay, so your lumbar spine really likes stability. And the biggest thing that plays a role for this with you guys, whether you're getting your average, I sit too much, or I've been working from home, aches and pains, or I just bent and felt a pop and I can't move, the majority you're going to say is I feel tight and stiff, or I can't move, I can't move, I can't move. And a lot of that is we're having creation of muscle tension to create that stability. Okay, whether it's from overstretching slowly from sitting in one position, or overstretching quickly, causing a little bit of a tissue injury with a quick bend and lift. Okay, so the response is the same, it's guarding and bracing. And this plays a huge role because we are going to look at using exercise to promote that stability. Okay, and it's pretty simple, but again, if we have a little understanding as to why we're doing that, I think it's going to help quite a bit. But keep in mind, remember I mentioned there's a number of different tissues in the lower back, whether it's joint capsules, ligaments, muscles, tendons, whatever. Injuries to these different tissues are probably going to seem the same. I'm going to have either it's dull, achy, nagging sort of tightness and pain, or it's really sharp, grabbing, crazy pain, I can't move, it shoots in the area, it feels like a stab. That really doesn't tell me any difference between a muscle tendon or a joint capsule, ligament, that kind of thing. We're going to have guarding and bracing regardless. I'm going to lose range of motion so I can't move. Very similar stuff. Another principle I want to go through, and again, this is the most important if we're having I've been on the couch too much, or I'm an office worker and I have just achy, stiff low back, is called tissue creep. And tissue creep, I want you to think of tree sap slowly running down a tree, or heating up a piece of gum, or something really thick. When you have your stretchy tissues, your muscles, and you hold them in a specific position for a long period of time, let's say in a seated position, you're holding those tissues in a stretch. And those muscles are active. They're going to try and resist that stretch to give you that stability. As time goes on, they're going to fatigue out and give up, or your brain is going to kind of turn them off because your brain is really, really good at conserving energy. Okay, so it's using energy to keep those muscles in place. But I'm just kind of hanging out there, sitting in my chair. Okay, so once those stretchy tissues have relaxed from that stretch, now that tension that I'm giving, or that position that I'm sitting in, is putting some of that stretch into my non-stretchy tissues. Okay, I'll repeat that. It's putting some of that stretch into my non-stretchy tissues. So my ligaments and my joint capsules. And again, these are really, 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 really sensitive tissues, but they're very small. Injury to one of these small tissues in what we would call a micro sprain, very, very limited amount of actual tissue damage, will create a maximal amount of spasm, pain, and guarding. So, tissue creep. I'm sitting in this position for a long period of time, starting to get kind of achy, it's getting a little bit sore. Again, it's been maybe an hour, 2 hours or so. I am putting stretch into my non-stretchy tissues. Where this can be a big problem, and I know some of you have had this problem, possibly recently, possibly in the past, is when we have that quick jolting pain after one of these instances. So I want to run a couple of scenarios by you. The first one is, I like to use this one, is the building IKEA furniture. Because we've all done something similar, but we're on the ground, we're in this kind of hunched position, we're trying to read through the instructions, it's just pictures, there's no words, and when it is words, it's in Swedish, so we don't know what it says. And I'm going through there, and it takes me about 2 hours. And I'm in that position, I'm really hunched over. I start to get kind of sore and achy, but it's not too bad. I'm not debilitated, it's nothing crazy. I'm just having some pain there, and it's, mild. You feel like you want to stretch it. Right, what I've done now is overstretch some of those muscle tissues or stretch them to the point of fatigue. And now I've put a little bit of that stretch into my non-stretchy tissues. So here's where the scenario gets bad. I finish that piece of furniture. It's a couch. Now I go to pick up that couch. I've done so at a time where the stability of my low back is slightly compromised. Those muscles aren't quite ready to do their job, to produce force, to allow me to lift that. I put a little bit of that force into one of those tissues that doesn't like it, bam. And now I feel that sharp pain, I can't move, I gotta go home, I gotta lay down, things are sharp, it hurts to breathe maybe, all kinds of discomfort. Again, I have not done a massive amount of trauma, I haven't broken anything, I haven't blown anything apart. It's likely a really, really small amount of actual tissue injury, but I get that massive guarding response because the area is not happy with that kind of thing. So, super important. The other thing I want to run by you, another scenario with this, and this is a real life scenario based on our tissue creep research and understanding. Have you ever wondered why the luggage pickup, or the turnstiles at the airport, is so far away from where you exit the plane? The reason for that is this phenomenon. Okay, it's about 5 minutes, maybe a 10-minute walk to get to your luggage after you get off your plane. That's because I've been sitting for, let's say I fly all the way to Australia, I've been sitting for 20 hours, 21 hours, something like that. I go to get up, if I go to pick up that massive luggage right away, we're going to have a lot of increased incidences of back injuries. And so with this tissue creep, one of the biggest things and the easiest thing to keep in mind, you can decrease that or improve that issue with like 30 seconds of moving around. Okay, so just generally walking to the turnstile to go get your luggage, and all of a sudden you're not feeling quite the same, you're ready to go again, and there's less back injuries. So, when we look at our exercises specifically, that's going to be the premise behind some of these, and this is the biggest why of all. So why is exercise helpful in acute pain, meaning I can't move, I'm in spasm, it's really sharp, and why is it helpful in my average achy, sore pain? So, when I move a joint, and I move it back and forth, I am actively contracting and relaxing those muscle tissues. When I do that, they warm up. And by warming up, it means I'm pushing blood into the muscle. That's how you heat yourself, you move warm blood into your tissues. So I'm warming up those muscles. When they get warm, they get more pliable. They can produce better force, they can take more force, they're stretchier, they're mobile. So they're less likely to have a quick tear, as if you were to freeze an elastic and then pull it, okay? When I also move that joint, I am moving fluid within the joint itself, okay? Consider this the oil in your engine. If you leave your car out all winter, you don't start it once. When you go to start it in the spring, your engine is seized, it's not gonna go. Your brakes are probably fused here. So what I'm looking at here, there is fluid inside your joint tissues that nourishes and lubricates the joint surfaces themselves. You replenish and recycle that fluid by simply moving the joint. So if I don't have an acute back injury, I'm not stuck, I'm not bedridden, I just get my average, I've been sitting on the couch, I'm kind of sore pain. Physically just moving my back in a safe way back and forth for a period of time, I would bet you a lot of money that that's going to have a pretty big improvement immediately. You're going to say, wow, that actually feels looser. I don't feel like I need to stretch now. It doesn't hurt as bad. Okay? So we're physically pumping fluid out of the joint. We're increasing blood flow to the muscles. We're increasing nerve activity in the muscle tissue and the joint tissue. So that's going to play a big role in pain. No nerve activity, no pain. Or sorry, no nerve activity, no feeling, no issue. So when I move it, stimulate it, I know what's going on, it hurts a little less. And lastly, when I improve how those muscles are moving, I'm going to encourage more stability of the joint. So my last little comparison before we move on a little bit here, again, I apologize if I'm talking too much or if it's too sciencey. If you like that and you need more explanation, please send us an email. We'll try to answer questions at the end too, but I know a few of you have probably jammed your finger before or jammed your knuckle. You're playing basketball with a friend, or you're throwing the football around, or you slam it into something, and it gets kind of purple for maybe 2-3 weeks or so. It really hurts. You start your day, you can't move your finger at all. It's super stiff, it hurts to move in every direction. As your day goes on, it feels a little better. It's maybe not gone, but it feels looser, you feel like you can move it a bit. Maybe now it only hurts when you squeeze a tight fist. Then I go to sleep. I wake up the next morning, same thing, back to the start. It feels really stiff, hurts to move. The more I move it, it feels better. I am literally pumping inflammation out of that joint and replenishing the fluid inside of it. Okay? So for you who maybe just hurt your back and you cannot move, being bedridden is not the right option. You need to find a way to do some movement. It doesn't have to be crazy, but even little bits of movement is going to help speed that along, decrease that pain, and give you a little bit more movement. Okay? One of our world-leading researchers in lumbar spine mechanics, his name is Stuart McGill out of Waterloo, Ontario. He uses a term he calls spinal hygiene. And there's a couple of exercises, there's 3 in particular, and 3 of them we're going to go through specifically. He calls them that, doing your spinal hygiene, because even if you're not in pain, even if you are in pain, regardless, at the end of the day, you know you've done something to move those joints, activate those muscles, improve your stability. So just the same as you would brush your teeth, you do your spinal hygiene. And really, the amount you do this, how difficult you make it, is going to be a spectrum based on you individually. So if you're on this call because you just hurt your back yesterday and you can't even move, you're going to use these exercises, you're going to do them on their easiest version, and you're maybe only going to do them 1/3 as much as someone else. And maybe you're a strength coach, or maybe you're a power lifter, you like to lift weights, you do a lot of exercise, but you have back pain every week. And maybe it doesn't stop you from doing that stuff, but it bugs you. You're probably going to do these exercises every single day, and you're going to work on increasing their difficulty, okay? Because you're already performing at a pretty high level. You need all that musculature and that tissue to catch up with what you're already doing. So you might look at a different version, same exercise, but 1 step tougher, okay? So we're going to cover some of these guys now. We'll go through a little bit again. If there's any questions, please send us a message. We'll open it up for a little bit at the end of that, but we're going to get things moving. So we're going to start with what we call a release or relief movements. These are generally going to be more along the line of stretches. And again, our lumbar spine loves stability. So sustaining a stretch to it isn't necessarily going to be super, super helpful. But if I'm in acute discomfort, this might give me a window of opportunity to feel a little bit better. Okay? So that's kind of what we want to look at. And if I need to use that, if it helps, if now I can move a bit better, then we're going to do what we call activation exercises, which essentially are more moving or loading, better term, strength exercises. Okay? So we're going to kind of get up and move here, and before we do that, we're going to start with a little bit of a self-assessment. So if I hurt my back or if I'm feeling pain, there's a couple of questions I want to ask myself to figure out if I can figure out how to deal with this or what I should do.